So what we can do is start with a little bit of some release of stuff, and then if we want to, we'll go in and see what the trailer looks like.
Okay.
If that, or is it too far away to do both?
I put the trailer right outside the round pen.
Oh, okay, perfect. Then we
Yeah,
can go from
yeah.
there. All right. So let's just see what, yeah, I see, buddy. Okay,
I've been working on trying to slow down his breath, but I don't know if that discomfort makes him breathe faster or what.
right. And we'll just give him a second. Was he doing this before we got on, where he's kind of just zoning out a little bit and
Yeah,
relax?
and I was breathing with him, trying to slow down his breathing, and twice he presented his left flank to me.
Okay. And
And he was on.
okay, he's got some stuff. He feels like he just wants a little bit of just us to hold some space for him for just a little bit here. Yeah. Okay. And then we'll see what else we need to do. Yeah, you are breathing kind of interesting. Okay, so let's just see. Yeah, it's a little rapid. It's a little back by the flanks. Okay. How does your breathing feel?
I'm good. I'm down to like 3 or 4 breaths a minute right now.
Awesome. Awesome. You feel like it's all the way through your body, regular.
Um, Only if I don't do anything else and just think of that.
Okay. All right. So let's just think of that for just a minute. And we're just going to see if we can help him through his breathing. So, what we can do, I don't know if I've showed you the one where I just put my hand on their side.
Oh, I've done the rump, but not the side.
Okay, yeah, let's do this one. Okay, and I'll explain it to you, and then what we can do is that. All right, so I see it still, his breath is kind of just in front of the flanks, essentially, right now, and it's a little irregular. Okay, so what you're going to do, provided you have good slow breathing and it doesn't feel like it's stuck anywhere, you can do this one. What you're going to do is look on him and put your hand just in front of where you think the breath is currently getting to. Okay. And you're going to stay in the direction you're at right now, just like right now. And you'll just put your hand on his side. And you should be able to find a spot where you don't actually feel your hand move with his breath. Like it's
Mm.
pretty still. Okay. And then you're going to ask, are you breathing? Or breathe to my hand. Can you breathe to my hand? And you go in and just think about your breath being very smooth, slow, and regular. And you can even close your eyes or just keep them fixed off in the distance softly. And then when you feel your hands start to move in a slower, regular fashion, you're going to tell them, good job. Good job. Okay. So it's just another way when they're a little bit stress breathing like he is right now. We're going to see if we can help him think about moving that breath up forward. Wow, it's very interesting. I'm getting a feeling right under my chin that's a lot of stress. Do you want to let that one go, buddy? There we go. There you go. That's a good boy. Good boy. You got it. Yeah, I think he's got a little pain thing going on, don't you?
Hope
Um,
so.
yeah. Okay, so yeah. Ugh.
Much better.
There we go. Good boy.
Good job. 3 more.
There
Three
we
more.
go. Good boy.
So,
There we go.
good job, Lola. He's even had some mucus draining from his nose recently.
Okay.
I'm sick, and I usually don't see that on him.
It's
And the last couple times I went up to see him, he yawned and yawned and yawned. So I think
this
it's
is
all.
this is good that he had that big a release, but it's really weird. Like right underneath my chin, it
Mm.
hurts, and
Oh,
I don't know what that would be.
mm-mm.
I'm just
Clenching. Is he clenching? Or
I
no, that
don't,
would be.
it, it doesn't really feel like it.
Mm.
So hmm.
Debbie's joined us.
Oh, Debbie.
Sorry,
Hey.
it's okay. It's like we're gonna help. We think he's in pain. We think he's developing ulcer. And so we're gonna work on trying to slow his breathing right now. So that would be a way to try. So
Okay.
if we can do that.
So this
Okay.
could be a little bit residual from this other stuff because I am feeling it now more like a TMJ thing coming down from, especially on my right side.
Okay.
So it could be, and so let's go ahead and if you're ready with your breathing, you can find your spot that you think that it's pretty still in front of that where he's breathing and just lay your hand there. And then we're going to ask him, can you breathe to my hand? And you just focus on your slow, regular breathing. We'll wait till whatever that was goes by. Okay. All right, good boy. And you can put it down low. Yeah, right about in there. Good. Did you see him just like go down another level of relaxation? Good. Okay. So just all you have to think about here is just your hand, feeling that breath. See, it's already starting to move a little bit up further. Can you breathe to my hand? Yeah, it's something. I don't feel like he's altogether physically okay today. And I don't know that it's just an ulcer thing. I think it could be a respiratory thing. I don't know. Let's just see what happens here though with the breathing, if we can get that to switch. Are you breathing? There you go. So I don't know if Debbie can you hear me, Debbie?
Yes.
Oh,
Yes,
okay. What are you feeling there in person? Does it seem like it's something physical to you? That it's
I I don't know yet.
okay. His breathing just feels different, but not like he's overall pretty relaxed, but it's like labored or something is not quite. There we go. Good boy. There
Good.
you go. Good job. Good job. How's it going there, Jeanette?
Well, in his ribs now, but it's still rabbit.
Okay, and just keep it wherever we wanted to go up to the front part. So you can gravitate, if you feel like he's getting to one point, you can just move your hand up an inch or two in front of that until we get up to the front part of his rib cage. And then just leave your hand there. Can you breathe to this point? There we go. And I'm going to just be breathing slow here, regular. See if there's anything else you got to tell us. All right. That's a good boy. I'm kind of almost, so let me ask you this. How long have you noticed like his breathing kind of like this?
I wish I could say that I noticed.
Okay, but it's not just today, I would think.
No, I wouldn't think just today.
Since the smoke incident, do you think it was do you think he had inhalation of a lot of smoke or
He
anything?
just had the trauma.
Yeah,
He lost his mother.
okay, because I don't know if it's requiring like a vet visit to see what's happening.
Okay.
We'll see what happens here for the rest of the session, but something feels a little off.
He is flaring his nostrils even.
Right. This is the thing. It seems labored, but there's no reason for it to be labored, right, Debbie?
Yeah. Yeah.
Okay. That's my concern here, that it's beyond, it's not really anything emotional going on here. This is something physical.
I took him to the golf cart yesterday and he was dragged behind me.
He was
Right.
dragging?
Yeah,
Yeah.
I thought he would, and then he just went to the back again.
Yeah, it doesn't feel good. I
No,
think that was
I don't think so. And I don't know how much we can get done with where he's at in a physical way, because I think that's kind of overriding everything else we're gonna do.
He's doing communications again.
Yeah.
So I'm thinking if it's a respiratory versus like an ulcer, I'm not picking up ulcer things. I'm getting a little bit, and that, remember when I said about my throat earlier?
Yep.
That burning, it felt like acid reflux, but maybe it's more of like a burning sensation. I don't know. Um, but something's up there.
Okay.
So
Touch him.
there we go.
Debbie wants to know if it's okay if she touches him.
Yeah, Debbie, you can go ahead. Because we're going to be working now at a physical level. Whoops. There we go. You got it, buddy.
Gee, huh?
Aw.
No, you don't like that. Huh? I touched his lower lip. His upper lip, he was fine. I touched his lower lip and he does that jerk.
Oh. Hi, buddy. And I don't know if it's just, how long ago did all of this stuff happen, Jeanette?
The fire was 10 days ago,
Okay.
but this lethargy today is the worst.
Yeah, he just doesn't feel right,
No, he doesn't feel it.
like physically.
Yeah. He's been eating and seems normal when he was with his buddy, turned out. But today he seems lifting his I got my hand on his belly right there. This is very kind of tender. His belly is tender.
Yeah, so it could be, that both things are kind of affecting him there. But I feel like we can't, yeah, this breathing's bothering me. And the thing is, he doesn't look bad. Like on the outside, he doesn't look really, really bad, but there's something in his demeanor that's telling me he can't really like physically be here with us. Like something physical is happening that's kind of taking his attention. So that's why it's like, I hate to do that after you already came there and everything, but just to say, I don't know that there's anything I can do.
No problem. No problem.
Oh. And we can sit here and talk, about other stuff too, because I don't want, Debbie, if you came all the way, I don't want to,
Talk to Dr. Susie and Jeanette. I'm cool.
cool. But, we can kind of visit here. The other thing that's bothering me is all those little wrinkles above his nostrils. Like he's flaring his nostrils a lot to breathe. And yeah, right in there. So that's concerning to me. If he were doing that and he was acting really like anxious or trying to bite you or doing something like that, I'd say, oh, that's a behavioral thing. No, this isn't. I don't.
I'll take his temperature and see if he's.
Yeah,
Mm.
because he feels like I just need to rest. And we can go through and just clear out anything. I'm just going to show him clearing out energetically anything that might be there. I'll just go in and check and see if there's anything going on. Okay. So just give me a moment. Okay. Is there anything else you need to tell me? Yeah, the physical sensations that I picked up today are so bizarre because I've never felt that underneath my chin. Like, ow. I can't even fathom what that could be. Like,
And when I touched his chin, he jerked his head up
Could it be swollen glands? Could it be something like that, like an infection, like micro, it doesn't have to be an overt infection, but maybe like a micro infection or something just starting up. He's like, why are you looking in my mouth? Oh. Do you feel anything underneath there?
No, no swollen
No,
gland.
rigid.
No glands.
Yeah.
Hmm. See, and I'm getting back that sensation of the acidy reflux thing, burning sensation in my throat. There we go. Okay, so he just licked and chewed on that one, which says, yeah, that's it. Somewhere. That's weird. Let me there we go. I know, bud. I'm sorry.
Started them on a 30-day omeprazole and CPAP.
And I not really, I'm looking at teeth thing. I don't think it's teeth related necessarily. Of course, I'm not diagnosing anything other than he doesn't look right. That's my biggest thing I can say here. Um, there we go, buddy. Um, hmm.
He's been eating okay.
Yeah, he has been eating okay. He stopped, lost weight and didn't well after he was put down. Okay.
Yeah.
What did he do?
So let's just hold space for him and then we can talk, but you're included in our conversation. Okay, Royal? Yeah. Yeah, he looks sad.
Yeah,
What's up? And we can talk to him about his move. He just looked at me. My move? What? What move? He knows about the move, doesn't he?
I talked to him about it.
Okay.
I was going to move him like if I was going to haul him over, let him be there for the day, move it, haul him back. But after talking to the barn manager and telling her about the fire and the mishandling, he said, Jeanette, just get him over here. This is a really chill place. So I have till the 28th to take him. I can change my mind.
Yeah.
But
Okay.
I know that, and I've been trailer training and I know that adds stress, so it's really hard. Did you want to leave? Is that what you wanted to do the lights?
Yeah, there we go, buddy. Okay.
No, you bye, Debbie. Debbie's good.
And what day did you think you're gonna move him?
Well, we were talking about this coming weekend. If not, I have till the following Friday.
Okay.
And I've been working on just loading him in the trailer, and I've been having difficulty with the slam gate. So I haven't like just let him be in there loose tied and then haul him out for a short haul. I haven't done that yet, but because I've been monitoring this discomfort in him.
Yeah. God, this is weird because now I'm getting, God, it feels more like an infection.
Oh,
I mean, just like, you know how when you feel like you've got just some low grade
oh,
thing going on.
oh.
And it may not be that critical. I don't know. So anyway, we'll hold
Yeah,
space here. And
yeah.
what
We
else
could.
is new for you guys? What do you want to talk about?
But I was going to say, is it okay to ask him if it's okay to move him? Does that work, or is he just too flat to?
He's kind of all he can do is holding it together right now. We can ask him. We can, add him to the conversation here and we may bring up something like
Yeah. Um, he's going to have a very large paddock. It's going to be 60 by 65.
wow.
Yeah, really nice with a three-sided shed. And he's going to have a new playmate on over the fence who's a 7-year-old quarter horse that loves to play. So that's going to be his new buddy. And he'll be able to see other horses, of course. And they have a round pen and a huge covered arena that's 2/3 covered. And then
Wow.
86 acres of hills that you can ride.
This sounds perfect.
I hope so. And they already carry his hay. So they carry his, he says, oh, thank you, Debbie, for being here. He's such a super, he's not doing that for Debbie.
Yeah. Hi, buddy.
I
Yeah.
just not, I just was, I don't want to put worry in. I'm just concerned about adding more stress to his life in the move. But I know if you move to a really chill place with a new friend, is that actually a good stress? Is that a eustress or a distress?
I wouldn't overly worry about it because you prepared him. You've told
Okay.
him. I would just do it. And don't put any projection onto it like it's going to be more stressful or anything onto it. It's just, here's where we're going, and you make it a like fun day. Hey, we're going to our new place. Here's where it's going to be. This what you, there we go. See, oops, I got to let a kitty out of the room.
Okay.
Go. Okay. All's well. One in, one out. There we go. That feel better? Yeah, maybe like us worrying about like what's he's gonna do, just
Okay.
prepare him and do it. And
Okay.
you keep upbeat on it. It's like I find like a lot of times horses are just happy if like if we don't get all worried about something and we start projecting, oh, this could be stressful or whatever. You're just like, and then we're gonna go do this, and then we'll do this, and then you'll have your new place. And then so you keep it all in this like, oh, sign me up for that one.
Love it. Yes. We started off thinking, and I said it's going to be so exciting. And then I thought, well, maybe we don't need to do exciting tonight. Maybe we're just going to, this is going to be so nice. Hello. Yes.
Yeah.
And so, clearly he, has been subject to the really uncomfortable conversations I've had with the business owner here about what's happened with him. And it's, I've been coaching myself really hard to let that be.
Yeah.
I know that it's compounded on him. And
yeah, it'll be over. And you'll go get in the trailer on the day we're gonna leave, and we're gonna go to your new place, and it'll be fun. You just make the pictures of everything just going smoothly. I usually just picture him at the new place,
wow.
settled in, having fun, meeting his new friend across the fence. Yeah, being able to run and play in that field or that paddock because it's big and you can actually move and run. Yeah, everything good.
Pastures. Yeah.
That'll be awesome, huh? Yeah. And we just see him getting along. You'll have that other friend. You'll get along really good. Yeah,
Tater Tot's going to be really fun.
there you go. Yeah, he's just off. Yeah, yeah, it's okay. It's okay. Again, it doesn't feel like it's really bad. It just feels like I'm just down a little bit. Like,
I'll take his temperature and maybe I'll talk it over with his vet, see if she should come out. But if he has a temp, then I'll definitely ask her to come out.
Yeah. There you go, buddy. And he's like, I'm just happy to hang with you guys today.
Wonderful.
And not have to do much of anything. We'll just have conversations. Okay.
Good chill. So without the Debbie and Susie.
Yeah. That's right. You can do a lot. Okay. How have you felt, Jeannette? Have you felt like you're overwhelmed or anything with everything going on, or?
I've been ill. My husband got ill twice, and so I got a sinus infection, which I'm finally getting over.
Okay.
So it's been a really.
He just said yes to that one. Did you see the change in his, and he came closer to the camera? when I talked about that. So he's
Yeah.
picking up a little bit on you've been down or you've been dealing with some stuff. So we're going to tell him he doesn't have to hold that for you.
Right.
That was very sweet, but you don't have to hold that stuff.
Mine.
It's a lot. Yeah, it's okay. Yeah. There you go. You can let it all go. Don't have to hold that in. All right. Yeah, there's just been a lot of stuff. It'll be good to have a new
It's
place.
ridiculous.
He's feeling a little bit of the conflict that's going on there. So this is a lot. I feel like that. Okay. It'll be done when you move to your new place. It'll be fun.
Right.
Yeah, that's right. That's a good boy. So anything else in particular want to talk to him about?
Well, I know his feeders are changing. I don't know if that means something.
His what?
His feeders, the feeders you feed him, the
Oh,
weight, yeah,
yeah.
he's not allowed to have hay nets anymore.
Oh,
Feeders are changing.
okay.
Um,
He's not, or anybody here.
huh? Oh, the new barn,
Oh, it's a new barn.
no hay nets.
Huh.
We're figuring something out right now.
Why don't they like the hay nets?
It's the barn manager's pet peeve. She doesn't like a hanging hay net, but I found out that I could get those high country junior feeders where the top slides out, and
Yeah.
I got with the hay net, and she's okay.
Oh, okay. Huh.
But he's figured out, like Karen Gerhardt's horses, he's figured out how to slide that out. So
Of course he has. You know. Yeah.
I've gone to the country more than once, and they just don't respond.
Yeah.
So
Porta grazers at my house.
Yeah.
I could borrow one to see if it would work for me.
oh, okay.
It's a
Right,
barrel.
I know what the porta grazer is.
Yeah,
Yeah,
Yeah.
I just didn't know if it really would slow him down.
yeah. They have to work at it.
Okay, thank you.
Yeah.
You can get them with smaller holes. Mine have the big holes because I was going to be soaking
Oh, yeah,
the hay, and so it needed the bigger holes. But
right,
they have smaller holes.
right,
Cool.
right.
Yeah. Would you like, let's see, let's talk about stories. Have you told him any stories lately?
Oh, when we were working on trailering. I told him that his mama was going to go in the trailer first, and we stood there and visualized her walking, and heard her go thump thump in the trailer. And he looked, and then I put him in, and I said, and Selena's going to go on your left. This is this big Orlander, serious mama bear mare, and put him in, and he seemed pretty okay with that. That was good. We've done that, and I said we travel as a family. And recently, Dr. Frey, I've made a big movement in my personal therapy last week, and
Uh-huh.
so I am much more fiercely a protector, and so I really feel the ferocity of my strength without having anger.
Wow.
Yeah, I can actually feel that now. So I just tell him now, come on, we're going. I'm more no nonsense. But that's a shift in me that's new for him.
Mm-hmm.
And I still waver. I go back and forth between, are you okay? Do you want to come? And no. We're just, come on, we're going.
Yeah. Yeah.
And his reluctance to go lately is because he's not feeling well, not
I
because
think so. Yeah.
he seemed to really respond to that, me just being very sure of myself.
Oh, I love it. Yeah. And it's such a difficult thing to do, but also such a very important thing because the horses, all of that kind of consent-based training that I'm seeing around is it just makes horses really nervous and they need and want a leader. They need and as long as you're firm and fair and consistent and you have a good direction, that's what they need. And then they can feel relaxed
I
about
don't think based training is.
you don't know about consent-based.
What does that mean?
Yeah.
It means you ask the horse permission before you do anything. Like the
Oh,
people that go, do you want your halter on now? And the horse says no, and you just leave. Oh, he just took a big old gulp, like, "Ah, don't talk about that." He was like, do you see him like leaving? Like, I'm not doing that kind of silly stuff. It's really stressful on horses. People
we
think
want,
it's being really nice, and
yeah,
it's really the horses that I see are a nervous wreck
yeah,
eventually because too many choices without any direction. They want somebody saying, and now we're going to do this. Oh, thank goodness. Okay. They follow. That's they're herd animals. They're in a
right,
collectivist society that
yeah,
relies on somebody being a leader.
okay. And I would say by consent based, if you're asking them, you're putting them in the leader role,
Right.
and they don't necessarily want to be the leader role.
No. No, and so that's why they're getting nervous.
Mhm.
Especially if it's a horse that's like, I don't, like, even with me, somebody goes, where do you want to go to dinner? Like, I don't talk about like, okay, now I'm stressed out because I'm happy to go wherever you go, except for sushi or so, there's a couple of like no's, but just decide and I'm happy to go. Or if I said I wanted something, I would tell you. But yeah, these horses, it's and those people are really thinking they're doing their horse a service by being so nice, and really it's abusive.
I think the only time I would even lean toward consent is if he's giving me clear messages like yesterday, he was dragging me. Okay, we don't want to go for the golf.
Yeah, right.
That's,
There may be times you have to defer to the horse, and he goes, "I see something you don't."
Mhm. Yeah, yeah.
This is very interesting how he's like came out of his thing right when we started talking about this.
I was like,
It's,
I don't want that idea.
I
um,
mean, watching someone, but still, they
yeah,
haven't really gotten any better. Maybe.
No, it
but
hasn't. So,
I think like even for you as you're talking about changing your idea, it's like you don't have to be mean about it. You make a decision and it's you like when I make decisions with the horse, it's soft, but it's very firm at the same time. It's like I know I'm still going to go there. I'm still going to do it and I don't waver. I don't question it. I just do it. You know,
Right. And the questioning is still a big part of retraining my brain. I mean,
uh-huh.
I start to see like, oh, maybe he won't go this time. Nope, we're not doing that.
Right. Right. And you see how often those little things pop in, those
Oh,
little insidious question
oh,
marks.
awful. Just awful.
And
Yeah, that's
I kind of watched, because I was one of those that was kind of wishy-washy for a long time in my horsemanship, and I was like, what was different? Like sometimes with men, they never were told by society that they shouldn't make a decision or they should apologize for their decisions that they make or justify them in some way. And so I was watching men make decisions and not men that were like really forceful, but just men that would just say, yeah, and I'm doing this and I'm doing that. And like everybody would go. And you didn't feel insulted. You didn't feel like you had to resist it. It was firm. It was a statement.
yeah.
And I was happy to do it because it made sense, it was logical, everything was good. Okay. And I thought, well, I could do those things. I could be that kind of leader. I could take on those characteristics of when I made a decision, I would do it without apology, without question.
Mm.
And then, let's say you make a decision and you go through and you realize something wasn't right with that decision. You don't beat yourself up, you just make a new decision.
Yeah.
Um, and that takes kind of that question out because there we go. He came on. I like when I'm doing this particular talk that I'm having about leadership. Do you see him coming more into this conversation?
Mhm.
Because this is
yep.
what he wants. The energy that I'm doing as I'm telling this story about how I do leadership, he's feeling that energy because as I talk, I'm simulating that in my body. And he's
Yeah.
like, yeah, okay, I get that. Um, the beauty is we don't have to be the way they used to teach me in natural horsemanship, like put your square your shoulders and get stiff and like be assertive. And I don't have to do any of those things because it's really just in my mind.
Yeah.
Right, right. Which just vibrates throughout your whole body.
Right.
Yeah.
Here we go. You see him getting closer to us? He's like, I'm listening to this conversation. I love it. And these are those like subtle things that tell us like, what does a horse want? What is a horse interested in? When
Well,
we gather their
the,
attention in a different way.
the story that I'm telling myself is moving to this place is going to be turning a whole new leaf. That I'm projecting that I will not be wishy-washy anymore, projecting that I'll be firm and kind, and more of a leader,
Oh,
and more of a leader, not question mark, more of a leader, and the phrase that the therapist and I worked on was that I protect.
yeah.
I protect.
Yeah. And your energy feels a whole lot better.
Oh, good. Oh,
Yeah. I
good.
mean, no, but this is why I'm doing the sacred space. I'm writing another book, and I'm on the chapter now where it's like, how do we do this? How do we become clearer? How do we change ourselves? And in the process, all the horses we're around are different, and all the people we're around are different, and
Yeah.
it's a bigger than just a horse training thing. It's about how do we evolve.
Mhm.
There we go. Oh, he likes that one. How do we all evolve?
How,
Is
I remember 40 years ago, my
he
instructors,
likes that one?
yeah,
Yeah. He's like, yes, thank you. That's what our horses have been trying to do.
we're trying to help you
Get
people.
people to evolve.
Yeah, tremendous gift.
Here we
I
go.
was a couple years ago, my instructor saying, you need to be more clear. But they never just go, oh, how am I supposed to be more clear? Yeah.
Yeah, exactly.
Big, sorry. I'm starting to chip away at that.
Cool.
And
Uh,
of course, I have to slow down so
yeah,
that my thoughts are clear before my actions come through. And that
yeah.
constantly.
Oh, if you want to hold a second, let me see if I printed it out because I put down like 6 C's to the how I do the communication. Hold on a second. I'm just going to run in and grab my I think I have it on a printout. Hold on.
In the preview. Yeah. Make sure I give you your saddle. Okay. I'm afraid we'll go, oh, here's mine. And did you want to go to lunch or? Sure. Okay. Have you been to Crepe Brew in Vegas? No. Well, they make crepes.
We'll see what he thinks of this
Okay.
of
Okay.
the because it's kind of a process that a little bit of a checklist, which I usually don't have in my stuff, but I think it's good. And then it's all C's. So you can think of some word that starts with a C. So the first thing we need, which we've got with him here, is connection. Okay. So we know he's connected to us because he's responding to different things we say. Um, so if we don't have that connection, we cannot have a conversation, right? Okay, so that's the next C. So once we've got our connection, then we can start our conversation. And when we have clarity, which is what you were talking about, you think something through before you say it or before you do it. So you want to be clear in that conversation. So we also want to be, like for horses especially, very concise.
Mm.
Okay, so very few words, more just short, to the point, concise information. Okay, so, oh, he just had a little thing. So that means that when we're being concise, it means we don't have extra thoughts, a whole lot of thoughts going on, other than just one single stream of thought along what we're doing, right? And our emotions are aligning with that. So our emotions and our thoughts are pretty clear and consistent. And they're appropriate for what we're doing. And they're not changing a lot. So the horses like to have a lot of just very clear, consistent talking. Okay. When we do communicate, then it's a statement, like what I said, ooh. Statements. He's like, statements. I gotta go think about that one. And not questions. So a statement and not a question. And that's where it's really different from the consent stuff. Yeah,
I'm just surprised he hasn't rolled yet.
yeah.
He was thinking.
Yeah, I know, that's what I was wondering.
Okay. And once we make a statement or we communicate something, we're going to stop and consider whether they understood it or not. So there's a pause point in our conversation with them. Once we've made a statement and we've said something, we're going to pause and see if that hit them in any particular way, if they absorbed it, if they thought about it. Okay. So there's that pauses in the conversation. So I'm always thinking of, am I talking at my horse or am I talking with them? Okay. So all of these C's, when I stop and consider, that's when I'm looking to see.
That's a little tricky because if you're being a leader, you're still talking with them, but you're also kind of talking at them in a sense, or no?
It's, think of it, it is sort of, but I usually, when I make a decision, I say, I'm going to go do this. I don't say we're going to do this.
Okay.
I say, I'm going to do this. So I'm telling them what I'm going to do. They're still part of the conversation.
Oh, okay.
Again,
they're included.
But the final thing I have to do is, when I pause and after I've said something is, do I need to clarify it?
Oh,
Do I need to say it in a different way? Did it get through? Did they understand?
and so if you're checking with them, then you would know whether or not you need to clarify.
Right. If they had resistance of some kind, if they whatever, looked away, whatever, do I need to clarify something about what I said? Okay. So those are some of the things to think about, but the pause in there is where it turns it into talking at them versus talking with them. Because if we're just talking at them, we're not going to really pause. We're just going to talk.
Right.
We're not going to see what their reactions are. We're not going to care. There we go. You want that one?
Well, this is the second time he's dropped since he's been in here too.
Huh. There we
He
go.
dropped, I brought him in, and now he's dropped again.
Huh. So, but it's kind of one of those things where even when people are trying to be nice to their horses and do all the right things, they're still just talking at them. They're not really including them in the conversation. Remember how when I said we're going to invite him into this group with us as a group conversation. So that's my energetic intention that he's part of this conversation, that he talking with him, not at it.
Okay. Yeah, sounds good.
So yeah, a lot of this is kind of just a thought rather than how it really happens. It's like an intention. Going to keep you in the conversation. Consider the things, but it's also, it gets to that thing where as a leader, if you communicated something and the troops all said no, you'd have to go and consider how would I state that differently. Oops,
Yeah.
there.
Yeah. Would you state it again, or would you have to take other things
Do,
into
do I
consideration?
need to clarify what oops, there I
Yeah,
see that, buddy.
spring
Right
in his.
there. I see it. You can let it go when you're ready. Oh, because I think, part of this with the thinking of the ways we communicate, it's like usually I have an underlying belief that horses want to do what we ask them,
Hmm.
but they often get confused about what we're asking or what
Uh-huh.
we're going to do. So that's where all these things of clarifying, noticing if I used the wrong word, if I didn't explain it right, did I put the right energy on it?
Mm-hmm.
All of those things.
Cool.
So this is
I like.
interesting. Hello, buddy. So I want to go over a couple things like you can do with him. Oh, he's already saying yes. Okay. So here's how it happens. It's like I'll have a thought, which I had when he was still on the other side, is like, let's talk about stories. And then he came right up into the camera before I could even verbalize that we were going to talk
Yeah.
about different ways to tell stories.
Yeah.
So um it's kind of fun to play with stories, and I usually don't necessarily make it a story about him. So you can play with stories about other horses or even about your life, something that happened to you. So if like you're hanging with him and you're just brushing, tell him a story.
Wow.
And what you do when you're telling stories is you think about the words you're using in the story, you try to make lots of pictures to go with it, you talk slowly. You put in all the emotions that would follow the story. So you're practicing in your own self how to go through and create these different emotions as you speak. So if you think about it, like if you were to read a storybook to a toddler, to make it interesting for the toddler, you'd probably use different voices and emotions, and you'd have different inflections in your voice to go along with the storyline. It's like sometimes there was more excitement and sometimes it was less. And, so you'd go through all of those things.
Mm-hmm.
And horses I'm finding they just love the stories. And he's now in the camera going, yeah, I liked when just you were telling that story and you went
Now
through.
his eye is much more open. It's
Yeah,
not.
right. And it's such a great bonding tool
Hmm.
with the horses. I might tell him like a story about trailer loading would be how this other horse like got through the trailer loading and could do it. And I don't make it about him. I'm like, I just make another character. It's another horse and he gets in the trailer, used to have trouble. You can go through the bad parts of a story. Like he used to have a lot of anxiety about getting in the trailer. And then one day he decided he could do it and um, he learned how to breathe or, I'll introduce something and then I'll take time to kind of imagine that thing and then he learned to do it and he felt so good about himself. He was so proud of himself when he did it. And watch your horse as you go through the different emotions. Like when I just said he was so proud of himself, he kind of blinked a little bit and closed his eyes a tiny bit. Okay, so we know they're reacting to these emotions, and you can kind of get an idea, what does my horse like as far as these emotions that I go through as I tell the story? What makes them melt? What makes them get, like, oh, I could do that, more confident, different things like that. So they're really fun to play with. And I would never, there's a lot of people that are saying, let's just meditate with our horses. It's like pointless. I mean, really, it's like you're leaving your body or you're just totally inner focused on yourself And the horse is there going, well, that's a great energy, but it's not creating any camaraderie between us, no connection really. Tell them a story and you'll connect with them. Yeah. Okay. And its story doesn't have to be, it can be silly. It can be a silly story. I'm going to tell them a story. It's like, this was a funny story. Not really funny, but here, I'll give you the example of this story. And I told it, it was actually a puppy that was listening to this story, and it was very cute. He's like, I'm leaving because it's a dog story. No, so it was the first time it really dawned on me that that animals are looking at the pictures in our head as we tell a story. Even if we're not aware of those pictures, they are.
Yeah.
So I was telling this story about this day that my neighbor's dog came in through the dog door, and it's this big black lab, big black lab, 100-pounder. My dog was in the house and he was a 100-pounder. And
Oh,
of course, the black lab went for the food. And my dog wasn't thrilled about that. So in the hallway, they're having this big fight. And I'm like, oh, great, And I'm telling my friend this story, and her little white puppy is sitting in front of me, like looking at my face as I'm telling this story, like totally engrossed in it, you know. And so I go, I didn't know what to do, and it's like they were going to kill each other, and I did the thing you're not supposed to do, but my dog was latched onto the back end of this other dog, and so I just grabbed the black dog's collar and I pulled 200-pound dogs down the hallway to the door, and I threw the black dog out and closed the door really quick and got my other dog separated from him. And it was so funny because I got to the point where I'm almost at the door and throwing him out, and I paused for a second, and the dog, I swear, he said, and then what happened? His voice, he did this little thing, oh, oh, and it sounded like, and then what? And his eyes were huge, and he was like listening to the story. And then I said, and then we got him out, and everything was okay. And he's like, but it was so funny to watch this little dog be captured into this story. So it's okay to add some things that are a little dramatic as you're telling the story, but it's also about how to resolve a problem. How did the problem get resolved? So sometimes I'll do that with a horse, like there'll be another horse, and it's like, here's how this horse resolved that problem for himself.
Oh,
And they learn through that. Yeah.
when
So,
you listen to the story, you put pictures in your head too.
yeah.
Telling the story, and I.
Oh yeah, I got the whole picture too. Yes.
Yeah. And again, the stories don't have to be real complicated. Ooh, there we go. And just different ones, or you can tell about something that happened to you. It doesn't have to be about horses.
Okay.
But that can help you also with that place, like if your mind goes to a lot of different topics,
Okay.
trouble staying on one. Telling a story will keep you engaged on a singular line of thought, right? That
Yeah.
you have to keep going, and you have to tell that story through the end. You can't go, and then this happened, and then I went to the store, and then I picked up all this stuff, and then I went driving to. No, you don't get to do those side stories. You have to stay on the one story. So it's a great brain exercise.
Yeah, focus.
Yeah. Well, I definitely need the brain exercise.
Yeah. And you can, yeah, then, and you're also, there we go. You're also working on your emotions, like
Yeah.
noticing when I say a word, can I create the emotion that goes with that? Can I create, oh yeah, good boy. Can I create the picture? See, now he feels better.
He does feel better. He's waking up.
That's interesting.
So his respiratory rate is still higher, but I think it's only.
Yeah. So we just kind of, I talk nonsense for this hour, but we'll just plan on another time after you figure out if anything's going on, or maybe after you get moved or something. Just
No.
keep in touch, Jeanette. I won't charge you extra for
Oh.
doing something. So we'll just
Okay.
consider this a nice little visit with all three of us, and A chance to see Debbie.
So
I see you.
today is paid for, so that's good. We'll start afresh. And this place I'm moving to is the one that even has crap cell phone. It doesn't have Skype or anything. So we got to get this one hooked up to Skype so I'm going to be closer to her.
Oh, wow.
We can trailer over and we can do
And I want to test it because it does seem like our cell phone coverage is better.
Oh, good.
okay. So maybe I can hold there for Zooms with you.
Oh, that'd be awesome.
And I
Yeah.
need to get together with you because I've had a lot of other stuff going on. And so my interaction with them has been very purposeful.
Uh-huh.
You know, I'm down here to do this. So there hasn't been a whole lot of connection. Connection time. And
Yeah.
so I want to schedule with you because I kind of think we need to do that.
Just jumpstart you.
Jumpstart us back into,
Okay. Awesome.
just because it's been crazy.
Yeah.
These last few months.
Right.
I have a kitchen again.
She has a kitchen again. Yay.
Oh, yay.
It's
Happy
beautiful.
dance. Cool.
Yeah, we didn't have a kitchen for 7 months.
That's
Oh.
unbelievable.
You don't realize those things that you take for granted. It's
A
like
kitchen thing
a kitchen.
is the biggest thing I missed.
Yes. You do
Wow.
everything.
That's
Yeah.
amazing.
There's no dog in the kitchen.
Wow.
Oh, and I got 2 puppies.
Yes.
We lost our 2 other dogs.
Oh, no.
2 long-haired Chihuahua puppies.
They're adorable. You
Oh, my mom had a long-haired Chihuahua. He was lovely.
These guys are black and white, right?
Yeah, they're black and white.
Black and white.
They look like miniature Papillons to me.
Yeah.
Because
Yeah.
one of the dogs we lost was a Papillon. And so I just love them. But, my intentions have not been into my horses for a while.
Yeah.
And so I really need to reconnect.
Well,
Yeah.
it's a good thing. Spring's coming. Yeah. Yeah. So anyway, once I get moved and settled, I'm going to be looking for places to Skype with you.
Okay.
And the hope is that also that this summer that this barn will consider putting in Skylink or Starlink or whatever.
Yeah. Starlink works really good.
Yeah, they don't have it down at the barn, and I guess
That's me too. I have Starlink at the house, but it doesn't go all the way.
Right. It only goes like 50 feet or something. Yeah. So I'm really hoping that they're going to come through with their word of doing that. But I just learned last week they spent the whole week replacing their well pumps. So
Oh, that's not fun.
I finished replacing my fence, and then the kitchen broke.
Yeah.
Oh, geez.
Shit happens. I think it's called shit happens.
So the fence is still ugly, but it's holding up.
Well,
Wow.
he's
Does the job.
he's walking around now and he's ready for lunch.
Oh, good.
Seems like he feels better.
Yeah.
I don't feel like it was a big thing, and maybe he just didn't want to. It could be. It's like I'm faking it today because I don't really want to do anything.
Very cool. And I will connect with you again when I have this lined up for us to be together again.
Okay.
I'm gonna keep my head in your course, your breath course.
Okay.
And I'll be busy disciplining myself as I move and transition. And it'll probably take me till the end of the month to actually physically be out of here, even though I move him. I'm just pretty invested here. A lot of stuff. I have to sell my golf cart. I told you that.
Oh, a lot of silly rules.
That's okay. I really think it's a crutch.
Yeah.
I mean, once I felt that immediately that it was a security blanket, and then the golf cart, okay. And then when I know I'm going to miss it horribly, but when I owned that it's a security blanket, then I'm really sure it's security. So it's like, oh man, I have to up my game now, Dr. Susie.
Yeah. But you've upped your game. You're different, and so you're gonna be able to do it.
I'm so glad you sense that. That's awesome.
Yeah.
I just have to, like I said, this change is just from last Thursday. So now I need to spend some time really just making it.
Yeah.
Every day.
Yeah, I wonder if he is faking it a little bit. I don't know. Feels much better now.
Oh, you wonder if he was faking it?
A little bit. I don't know. That was very interesting.
We might have
His
just,
energy feels different now.
he
Unless
had,
that's all he needed was for us to just hold some space for him to reconcile whatever it was.
well, yeah, he really, present now and awake and
He's like, yes, that's all I needed. Thank you.
come get some lunch. We'll take you for lunch.
There we go. You're so beautiful. He looks so good.
All right, here, let me use the whip.
Yeah, you're ready now? Oh, great. But now your session's over.
Thank you, sweetie pie. Thank you, Dr. Susie. That was wonderful. I really,
Well, I'm sorry we didn't get more done, but I think we couldn't have gotten all that much done.
sometimes I need you and Debbie here,
Yeah.
Yeah, because
See, now he feels better. That's so weird. Maybe it's, let's see what is breathing. He's still got some stuff though, don't you? Yeah. Okay. Well, we'll do, you just kind of keep an eye on him and just see what happens. Yeah.
Yeah.
So,
I will connect with you again.
okay.
If you don't hear from me in a month, it's not because I've gone away or anything.
Okay.
It's going to take me forever to move into this new place. And
I get it. I get it. All
well,
right.
thank you so much and appreciate you so
Oh,
much.
well, thank you. And Debbie, so good to see you again.
See you too.
Hopefully we'll see you guys. Oh, virtual hug.
Audrey to be here today too.
Yeah.
But Audrey's father died over Christmas, and she's visiting her mother to Sacramento this week. But she's been wanting to come to the last couple but she's been busily run down to Southern California because her parents have been so ill. So she's been torn about that.
Yeah. Oh, goodness. Oh, you made me do a yawn. You doing good, girl? Yeah. Things are better? Yeah. You feel a little better now. Yeah. So you can let go of whatever that was. Okay, buddy? He's like, yeah, okay. Yeah, his nostrils are still too flared for me to think it's not emotional. Something's
Resting respiratory
quite
rate.
right. Yeah. Okay.
Well, you take care, and we will talk again.
And I'll get on and make an appointment with you.
All right. Sounds good. You guys take care.
Thanks,
You
honey.
too.
Bye-bye.
Bye.
Bye.